first thing I want to say is that the WHO Quality Rights Initiative provides policy and lawmakers as well as implementers with innovative tools for advancing the rights of persons with psychosocial disabilities and mental health conditions by adopting a model that is recovery-oriented and promotes human rights. It embraces the paradigm shift which is envisioned in the Convention on the Rights of Persons with Disability, which Kenya is a state party to, and Kenya ratified the convention in the year 2008, and it was reviewed by the Committee on the Rights of Persons with Disability in the year 2015. So this paradigm shift that is envisioned in the convention is about moving away from treating persons with psychosocial disabilities and mental health conditions as objects to be managed or cared for, to honoring and respecting them as subjects, restoring their dignity, voice, power, and choice. The paradigm shift in mental health care is needed to end decades of neglect and abuse and violence, and to ensure that services are recovery-oriented and promotes the human rights. The toolkit permeates a new way of thinking that the public sector and mental health must be integrated into the whole of public policy. The WHO Quality Rights Toolkit moves away from paternalistic and excessively medicalized concepts, giving way to participatory psychosocial care and support in the community, and there is enough evidence that cost-effective and inclusive options with successful outcomes do exist and are being used around the world today. They just need to be maintained and scaled up. So what kind of reforms do we need in line with the Convention on the Rights of Persons with Disabilities in order for us as a country to effectively implement the WHO Quality Rights Toolkit? I think the CRPD requires the following kind of changes. One is the prohibition of compulsory medical treatment and disability-based detention, which contradicts Article 14 of the CRPD on security and liberty of person, and Article 17 on respect for physical and mental integrity, and Article 25, which clearly states that medical services must be provided on the basis of free and informed consent. We must be bold enough to acknowledge the historical and current incidents of human rights violations in mental health care in Kenya, and the failure of a system that relies too heavily on the biomedical model of mental health services, including the frontline and excessive use of psychotropic medicines, and yet these models persist. I think there are two fundamental concepts in relation to ensuring that services are acceptable, of good quality, respect human rights, and promote recovery. And this is something which is anticipated in the Convention on the Rights of Persons with Disability, and the Quality Rights Initiative actually, its base or its foundation is actually on the Convention on the Rights of Persons with Disabilities. And I think the first thing we must do is that we must reform mental health laws to ensure that they comply with the Convention on the Rights of Persons with Disabilities and they reflect international human rights standards and practices. And I'm glad that in Kenya we're in that particular process, but for us the threshold is how do we make that particular law to be compliant with the Convention on the Rights of Persons with Disabilities. Secondly, I think there is need to have a fundamental shift in mind and realize the provision of the mental health services might not lead to inclusion and full and effective participation in society. This opens up a greater debate about whether the kind of services that we are offering are promoting recovery and are ensuring that persons with mental health problems are included in the society on an equal basis with others. I want to reflect on fundamental principles that would make services to be recovery-oriented and promote human rights. And we need to reflect on Article 3 of the Convention on the Rights of Persons with Disabilities, which lays down the general principles of the Convention on the Rights of Persons with Disabilities. Lastly, I think it is important for us, even as we implement the WHO Quality Rights Toolkit, in line with the Convention on the Rights of Persons with Disabilities, to reflect on what the Committee on the Rights of Persons with Disabilities said when they reviewed Kenya in August 2015. And one of the recommendations of the committee was, and I quote, to develop a wide range of community-based services